I am a nurse. We have about 11 acres up on a mountain overlooking Mount Spokane. Nice. We've been here about 2 months. We moved from Miami all the way up to Washington State.
I think I do want to push the rock back to the raised bed.
This place was a farm, and we want to turn it back into a farm.
All right, so we definitely got to clean the chicken coop.
We want to grow our own food, our own vegetables, our own protein, and be as independent as we can and as responsible to the environment as we can.
Thinking if we go down the hill and keep clearing that trail out.
This is a dream come true. I'm very fortunate, and if it wasn't for nursing, I don't know that I would have had the flexibility and resources to get it done. For most of my career, I've been a NICU nurse, working in the newborn intensive care unit, taking care of critically ill infants. The baby was born 12 weeks prematurely. She was on a ventilator. Right now she's on CPAP, which means that the air is going through her nose. The machine is not necessarily breathing for her. And she will be starting feeds tomorrow, which is wonderful. Which is very good. I was born in Colombia, South America. My parents are Italian and Colombian. I moved to New York City when I was a kid. We were of humble means, so my mother told me when I was young that I needed to figure out how to pay for college. And so what I did is I went to the Army and got the GI Bill. In the Army, I was a combat medic. My experience in the Army really exposed me to helping people and having the skills required to help people in need. Nursing has changed my life by offering me a career, a lifelong career. One of the benefits about becoming a nurse was that it enabled me to pursue a career in academia and get a PhD. It is uncommon to have a PhD in nursing, but there's a great need for it, both from an educator perspective as well as from a scientific perspective. We need nurse scientists. Generally, infants in the NICU are hooked onto a cardiac monitor. I love my job. I do various things. I'm a researcher, which means that I have this agenda, which is to develop better methods to assess pain in infants.
Is this current? Is this following best practice?
I'm a teacher as well, which means that I teach the next generation of nurses. I also work with bedside nurses that are delivering care on a daily basis, and I help them translate the research that we're working on so that they can put it in practice. As a nurse, you have to be resourceful, and I think as a farmer or as someone who is living off the land or plans to, you have to be resourceful as well. Winter's approaching, and we're going to heat the house with a wood stove, so we need to clear the land and we need to harvest some wood. As a researcher and in my new roles here, a lot of the work that I do can be done just about anywhere. The flexibility is amazing. The best thing about being a nurse is that it allows me the time and the opportunity to search and to try things out. It offers all of these different opportunities. I am a father, I am a husband, I am a teacher, I'm a researcher, I'm a scientist, I'm a nurse.